Well, hi, I'm Dr. Michael Mirander. Once again, another medical minute. And today we'd like to speak about the flu shot. The flu shot is to try to help you to prevent from getting the flu or influenza. Influenza is a condition caused by the influenza virus. And usually when it hits you, symptoms come on rapidly, quickly. Oftentimes one gets fever, headache, sore throat, congestion, fatigue, which can be very significant, and body aches. I remember having influenza about 3 or 4 years ago, and the fatigue was so much that I laid in bed in one position so long that it hurts, which is why I try to get my flu shot every year. Usually around September is when they start giving the flu shot. Influenza affects approximately 20% of our population and can be quite disastrous in people with medical conditions, leading to pneumonias, bronchitis primarily, and multiple hospitalizations. Most people though will recover from the influenza within a week or two. Anyone can get the flu, whether you're healthy, whether you're sick, whether you're strong, whether you're tall, whether you're short. Anyone can get the flu, and it can put you down for days, which is why it's primarily recommended that certain subsets of our population do make every effort to get the influenza shot. Certainly anybody over 50 years of age, it's a good idea. Anybody who has medical conditions such as diabetes, asthma, sickle cell, good idea to get the flu shot. People in the medical profession, people in nursing homes, people who are involved in very important levels of care. For example, police officers, as we said, healthcare workers. I said, persons aged 50 years and over, residents of nursing homes and other long-term care facilities that house persons of any age who have long-term illness, adults and children greater than 6 months of age who have chronic heart or lung conditions including asthma, adults and children greater than 6 months of age who need regular medical care or had to be in hospital because of metabolic diseases like diabetes, chronic kidney disease, or weakened immune system, including immune system problems caused by medicine or by infection with human immunodeficiency virus. Children and teenagers aged 6 months to 18 years who are on long-term aspirin therapy and therefore could develop Reye syndrome after the flu, and women who will be more than 3 months pregnant during the flu season. Persons with the flu can give it to other people, which is why it's highly recommended that certain subsets of people do get the flu shots. These include doctors, nurses, and other employees in hospital and doctors' offices, including emergency response workers, employees of nursing homes and long-term care facilities who have contact with patients or residents, employees of assisted living and other residences for people in high-risk groups, people who provide home care to those in high-risk groups, and household members, including children, of people in the high-risk groups. Anyone who wants to lower their chances of getting the flu can receive the shots. The shot can be administered to children as young as 6 months. Persons who provide essential community services such as police, firemen, etc. should consider getting a flu shot to minimize disruption of essential activities during flu outbreaks. Students or other in institutional settings, those who reside in dormitories, should be encouraged to get a flu shot. People who should not get a flu shot are those who have allergies to eggs, hen eggs, or people who have had history of Guillain-Barré syndrome, a very debilitating neurological condition, or people who have severe infection or reaction to the flu shots in the past. People who have had a severe reaction to flu shots in the past should not get it. When you do get the flu, it's a good idea to get lots of rest, lots of fluids, take Tylenol, not aspirins, and take any medication to help you symptomatically, to relieve the symptom. Decongestants, soups, juices. Many times because the virus, it's not going to respond to antibiotics. But because a lot of times the influenza will pave the way for secondary bacterial infections, one has to many times end up being on antibiotics because of the propensity and the opportunist infections taking over to cause pneumonias, bronchitis, for example.
I'm giving you 3 reasons why you should get your flu shot this year. 1, prevents death. 2, prevents severe illness. 3, protects other people. These are the reasons to fight flu this year. Make sure you consider getting your flu shots this year. Thank you.